Good morning, everyone, and welcome to A Call with Dr. Cook. Today is Wednesday, March 30th, 2022. And Dr. Cook, welcome. We're glad you're here today.
Thanks, George. Good to be here. Glad you're here too.
Boy, I tell you, we've got a fully loaded schedule today. We're going to tackle some an awesome topic today. Our topic is female health, and I on a personal note, Dr. Cook, I have three daughters, and this is a very important topic at my home.
I think it's important to all of us.
Yeah, it's anyway, it's great. Just in the last little bit, we've had a lot happen. We've had a daughter married, and we've had two of them have babies. And so, there's just a lot going on, and it really makes an impact in lives and everything. And keeping those girls as healthy as possible just is so meaningful to me. So I'm actually very much looking forward to our topic today.
Well, let's do it.
And as always, we're going to jump into some wonderful slides. I appreciate the slides that you prepare for us. It helps convey the meaning so well. There we
If I
go.
did this right, we're going to see them. There we go.
Popped right up. I can see it, especially for females. So that's going to work.
All right. Well, I've got 68 slides, George, so we got to move through this quickly.
Oh, great. All right. I'll get some popcorn.
Okay. Well, it won't take that long, I hope, but here we go.
All right.
First of all, I just put in some visual metaphors to kind of give us a reminder of the difference between a male and a female.
Okay.
And whoop, I'm clicking too fast. There's our first one. Men are kind of like Piper Cubs. Women are more like jet fighters.
Okay.
They have a little bit more going on than men do. And as a result, one of the advantages of being female is that you have the ability to handle a greater diversity. At least I think that's, and some people would argue with that, and I think that's okay. But this is just a visual metaphor.
Okay.
The fifth one here, or the fifth slide. Evolutionarily, women are the gatherers and men are the hunters, and women are the ones who take care of children historically. And over time, I think that's affected the way we're built and the way we think and function.
Okay.
With those metaphors out of the way now, let's just look at the 10 most common reasons that a woman will go to a gynecologist.
Okay.
So the first one is general health, gynecological health, pelvic exam, irregular menstrual cycle, birth control, pap smear, breast exam, painful intercourse, changes in vaginal discharge, urinary issues, and maternal health care. I should say, George, this presentation is taken from one I gave to a group of doctors a month or so ago.
Okay.
And so it's more medically oriented than we might want to talk about with Limbicarc, because as you know, Limbicarc is not a medical device. We don't diagnose or treat medical conditions. But as you'll see, the principles of Limbicarc can be beneficial in these women's conditions. But let me narrow this field a little bit more with the next slide.
Okay.
I'm an Oriental medical doctor, and so I'm licensed as an acupuncturist. And over the years, I've had several women patients, and I've had a fair amount of experience. But with women patients and their specific issues, but women would not come to me for a general gynecological exam or a pelvic exam or a pap smear. But these other things that you can see in the black text color, those are things that I've commonly seen in my clinic. And number 4 there, birth control. I've never had a woman who's come in and said, I'd like a prescription for birth control, but I have had women who've come in and said, I'm trying to conceive and I'm having a hard time. Can you help me, figure this out? Right. And so we're going to talk about that too. So I'm talking today about things that I've had clinical experience with. And what I've done in this presentation is created a little icon by each of these, and we're going to put those icons at the top of the page as a reference point.
Okay.
Now, the beginning of dealing with uniquely female issues is a toxic overload. And a toxic overload can be the result of some kind of malfunctioning drainage pathway. These drainage pathways are referred to as emunctories, and you can see in this graphic what they are. And the way you deal with that is through some mechanical means. For example, you could get a colon hydrotherapy, and this helps clean out your colon and it helps you get rid of garbage. You can also do things like specifically focused on lymphatic drainage. The lymphatic system is essentially the garbage channels of the body. And
Okay.
if you have some kind of an issue lymphatically, it will cause all kinds of grief. So you can deal with that, and you can deal with lymphatic drainage through things like the lower right slide here is dry brushing or getting a massage, or you can use these vibrating mechanisms or a little mini trampoline, or even riding a horse will help your lymphatic system function the way it's supposed to. So the mechanical things aside, and those can't be overlooked, I should say. But if I'm looking then to Limbicarc as an additional support in my quality of life, I would look to the Detox Info Boost. And so you can see here in the library, we're in the Info Boost library and select the Detox one. And I should mention for those who live outside the United States, the image that I've got on this slide, the woman who's flexing her muscle, uh, that's Rosie the Riveter. And Rosie the Riveter was an icon that became popular during World War II when women in the United States had to go to work in factories doing jobs that historically were men's jobs. And they found that the women did them just as well as the men did. So this is kind of an image of how tough women are.
Yeah.
So the detox. So back to the detox issue. So now I'm selecting the Detox Info Boost. And the next thing I want to do is select the Spark Scan Info Boost because I want to run a Spark scan on this. And after I've run the Spark and it's run the scan, then I click on Scan Optimize Default Boost Ingredients. And inside that screen, I will then select the top items. Now, I don't select all the items. I know some people do, but my preference is to be a little more focused, a little more specific, and I take the top few and include those. Now, there's one other thing that we've added to Limbicarc this last month, and let me show you how you'll use that. So the next thing you do is you click on the little button to collapse this window, and you then go to the category that says Scan Optimized Additional Boost Ingredients. You click on that one, and you click on Ingredient Categories,
Okay.
and then you scroll to the bottom. Let me see if I hit that. I'm clicking on my trackpad. It's not advancing. Let's try it. Here we go. There it is. Okay. So you
TCM.
scroll to the bottom, and there's a new category called TCM Female Acupuncture Points. You open that up, and you'll see there acupuncture points that are specifically used specifically, and not just for females, I should say, but in female conditions. And you'll see this through this presentation. These points are good to use for females, and these are the ones that scored higher. So then I would select those points and include those in my info boost. So then I scroll back up to the top.
So this is a way
And
to
when I
get the
get
library to focus in on the TCM items that are associated with your scan, right?
right, so I'm including in this info boost the items from the detox info boost and the items from the female acupuncture points list. So
Okay.
those will all be included in the same info boost.
Great.
So you hit the activate button and away you go. And that would be then um, way I would address detox. Now let's talk about irregular menstrual problems. And you can see I've circled that icon at the top. And this chart illustrates a textbook menstrual cycle. Now that means that if it's an ideal menstrual cycle, this is what it's going to look like. But not every woman has this exactly. And we don't have time in this presentation to go through this and talk about it in detail. But the bottom line is that from day 7 to day 16, those are days that a woman can become pregnant. And you might look at that, and in some textbooks, they'll say the window is narrower than that. But actually, sperm can remain viable in a vagina for 5 days. And so you may a woman may have intercourse 5 days before she ovulates, and then she actually gets pregnant 5 days later.
Okay.
Um, so it's this time frame in the idealized menstrual cycle that a woman can become pregnant. George, I should mention as a side note, there is one birth control strategy that says, well, just don't have sex during that window. There is a name for people who practice that type of birth control. They're called parents.
That's okay. Yeah.
Okay, so let me go to the next slide. These are acupuncture points that you would use typically for a woman who comes in and says, I'm having, menstrual cycle problems, and can you help me? And I will tell you, these work like a champ. You see on the right, I've got 4 of these that are the text is in red. Those
Okay. Very
are
nice.
kind of the superhero points. And for any woman who may be having menstrual issues, uh, I- look at our model's right leg down on her ankle. It's SP6. That's spleen 6. If you find that point, well, let me back up. Just before your period, that point will become sore. And if you have PMS or if you have, difficult or painful menstrual cycles, take a blunt instrument like the eraser on a pencil and just massage that point. And it's going to be easy to find because it's going to hurt. And, you don't want to push too hard. You don't want to hurt yourself, but you just massage it gently. That will relieve a lot of the menstrual stress and pain that you might be feeling. That's a little aside from Limbicarc, but that
Interesting.
is a trick you can use. Okay, so those would be the points, and this is a picture of actually a patient who let me take some pictures of her as we had needles in her, and you can see the arrow. These points are all along the bladder meridian, which runs down the back. It ends up on the small toe on the foot, and the arrows indicate the direction of flow of energy. And so when you're needling, and I don't know that anybody in the limbic arc world is going to be needling these points, but maybe this is just an interesting aside. What you do when you start needling points on the bladder meridian generally is you'll anchor it. So you can see the anchor down here in her ankle
In the
in
foot. Yeah.
bladder 60. Well, the reason that needle is there is it's to pull the energy down that is released from the needles further up in her body. Um, if you don't do that, you can actually create headaches. So you'll get the energy and it might move the wrong direction. And the patient says, oh, this is terrible. I don't want to come back. Okay. So that's menstrual issues. Now, the next item is irregular menstrual stuff. I mean, like unusual menstrual flow of some kind, or maybe a urinary tract infection or a yeast infection. And the first thing that I look for when I see this as a clinician is diet, because the woman may be eating food that is actually contributing to the problem. Now,
Oh,
the problem with food and the problem with any lifestyle problem, in other words, anything that I regularly do as part of my lifestyle, if you tell me to change that, that's probably the most difficult thing you can tell me to do. If you
Right.
say, "Hey, take this pill," well, that's easy.
That's easy.
If you say, quit drinking Coca-Cola, and
That's
used to
hard.
having 12 ounces of it a day, that's almost impossible. Most
Yeah.
people just flat won't do it. So what I like to do is to look at the overall food picture. Okay, what are you eating? What are you consuming? And let's not say, "Oh, eliminate everything that's bad for you," because we all eat stuff that's bad for us. But I would take one item. So I might take the soda pop and say, "Okay, can you stop drinking Coke for 2 weeks?" And most people will say, "Yeah, I can do that." But if you said, "Can you stop eating pizza and drinking Coke and stop eating bread for 2 weeks?" People are gonna go, I'm not sure because I don't know what else I'll eat."
Right.
So anyway, my point is look at your diet and don't worry about everything. Just pick one thing or maybe 2 things that you shouldn't be eating and eliminate them. And that just helps you. Now, in addition to that, you can look to Limbicarc and you can look to these info boosts. So I've got allergy, digestion, resolve, and weight. Those would be appropriate to use for someone who is trying to alter their diet and eating smarter and more healthy. Um, and I'm not going to go into the reasons why, but those would be good info boost choices. And if we look at the acupuncture points that you would use with this kind of an issue, these are those points. And again, you don't have to use all those points, but you might use some of them. And again, you don't have to memorize these. When you do the scan, so let's say you went in and you picked the allergy info boost in this case, and you picked the top items in the allergy info boost, and then you scroll down and you selected the female TCM acupuncture points. You would then select just the top items. And don't worry if it's the ones that are on this list, because in that grouping are all of the points that are included in this presentation. And you would just select the top ones, and that's the way you use it. So you don't have to get technical. You don't have to become a practitioner to understand what it is you're doing. And again, these are some of those points. You can see spleen 6 there that I talked about. It's just above the internal malleolus. Okay, let's go to the next slide. Okay, painful intercourse. This is a problem that is complex enough that you really need to look at the entire triad of health. Uh,
Oh, yes.
and
Yeah.
so let's start with the functional side of it. From a functional point of view, anatomically, there's a lot of stuff going on in the area of the vagina. And so there may be some mechanical issue that is creating this pain issue. And so that has
Sure.
to be addressed. But that's not where I start. Usually, I'll start with some kind of energetic intervention. So it would be appropriate, in my opinion, to start with an info boost. And these are 4 that I would look to begin with. Now, George, let me mention what an info boost is. An info boost is just a collection of boost ingredients that have a known impact on a particular issue or a particular category. And it's just a way for us to help people navigate the library easier. So if you're
Okay.
looking for something that has to do with pain, well, in the pain info boost, we've just put in all of the items or a lot of the items in the library that will have a positive impact on pain if you were to take that item, physically. So let's say that um, one of those pain issues was vitamin C. Well, vitamin C, if I took vitamin C, it might help my pain. So
Right.
we include it in the info boost. So that's what an info boost really is.
Well, and I think that that's what most people appreciate, Dr. Cook, is this is a way to leverage knowledge of other people into something that's easy for us to understand. I don't have to be I don't have to understand all that you know to be able to use an info boost and to take
Right.
advantage of that knowledge.
Okay, so that's the functional side of this. Now, let's look at trying to get to the next one. There we
Oh,
go.
the
Let's look at the
emotional piece,
emotional
of
side.
course.
The emotional side is going to be a biggie here with this particular issue, and it for lots of reasons. But let me give you a scenario, and this is not necessarily typical, but it is not atypical. In other words, I've seen it. A woman comes in who has been sexually abused earlier in her life. Now she's in a healthy relationship, and sex is part of that relationship. But sex to her is very painful, and there's no mechanical reason for it to be a problem. But the problem is this prior sexual abuse has created an emotional scar, and the emotional problem creates the pain.
Right.
And so the easiest way with Limbicarc to approach that is with a CERT boost.
Right.
And so I would do CERT, and I would have her, just talk about the pain. She doesn't have to talk about the sex abuse because that may not even be the issue. Uh, there are lots of reasons to have emotional issues that create pain, and sex abuse is just one of them. So you don't think that that's the only problem.
Okay.
But just talk about the pain, and you'll load up that CERT info boost then with items that will be helpful in releasing that perception, and then watch for the result. And it may create a miracle. You may have an immediate solution, but look for subtle changes because that's more commonly what's going to happen. And that's a good way to use limbic arc to help with the emotional side. Now, when you get to the energetic side of this, that's when I would do the acupoints. And again, I would do the CERT info boost in this case. I would probably take one of those functional info boosts, and then I would go down to the TCM female acupuncture points, and I would select the top ones like we've done shown before. And these are some of the ones that typically you would needle for a woman who is having this problem. Now let's move on to conception. So
Okay.
let's a woman comes into the clinic, or you say you're having a problem conceiving and you're interested in having a child. First thing to remember is it takes two to make a baby. So and a lot of times we think, oh, if there's a problem with conception, it's just because the woman is having some kind of a problem, when that's not always the case. It can be a male issue, and you need to address both uh, prospective parents to be successful. And so sometimes this isn't easy. You say to this woman, okay, I want you to bring your partner in, and we're going to talk about this together. And let me go back. I hit two slides there. There we go. The first thing that you do is you do a detox.
Detox.
And the
Huh?
detox info boost would be appropriate for the female and the male.
I'm sensing a
And we
pattern
talked
here,
about
Doctor.
yeah. Actually, the detox is appropriate on any of these to start with, so
Yeah.
it's not a bad thing to do. The next thing I would advise these prospective parents is don't worry about getting pregnant. In fact, don't even try to get pregnant because what we want to do is we want to figure out if we can what's going on, but we want to use therapies that will make you healthier. And the healthier you are at the moment of conception will impact the health of your baby. And that applies to the man just like it does to the woman. If a man is healthy, he's going to create healthier sperm, which will make a healthier baby. And sometimes men go, really? And the answer is, yeah, really. So don't try to get pregnant. And the timeline is about 3 months. So this is a 3-month program. At the end of 3 months, you know, then you can not worry about birth control anymore. The next thing, though, that you look at with the female in particular, at this point, I would say to the husband or the male partner, okay, uh, just be a good guy and do this stuff that I've told you, but now let's focus more on the woman. And the thing that I would look for is called a focus, or it's AKA, which means also known as a focal disturbance. A focal disturbance is something going on in the body that's creating a barrier to, in this case, conception. And on this slide, when I imported this slide, George, I actually had a drawing on her lower abdomen there where you would see a C-section scar. Now,
Oh, okay.
the reason that scar can be a problem is because there are three acupuncture meridians that run down the front of the abdomen: the stomach, the kidney, the conception meridian. And you can see the kidney and stomach are bilateral, they occur on both sides of the body. Um, if you have a scar that is impinging the flow of energy in some way, it can actually create a change in the woman's body, which will then throw off her menstrual cycle and maybe, stop her from conceiving.
Oh,
So,
fascinating.
that is what's called a focal disturbance. So you have to treat that um, in order to get the energy flowing the way it should, so the rest of the body functions the way it should. Now, the next area commonly found where the focal disturbances are commonly found is in the mouth.
Okay.
And the tooth is not, it's just not a tooth issue. It's called an odonton. The odonton is the tooth and its surrounding environment. So even if you had, let's say your third molar was pulled, and you can still have a problem with that odonton because the space where that tooth existed still remains. So you look to teeth, and the reason teeth are significant is because the meridians flow through different teeth. And you can see on this chart, I've got a couple of these, or four of these teeth with the box around them.
Yeah,
Those
there. Yeah.
relate to gallbladder and liver. Well, if we look a little deeper into that, you can see that those four teeth also have to do with ovaries, testes, and the intermediate lobe of the pituitary. So if you have an energy blockage that's caused by a focal disturbance affecting one of these teeth, it may affect your ovaries in a way that you you don't ovulate the way you're supposed to, and so you don't get pregnant. So you look to teeth. Chronic infection is also another area where um, focal disturbances will occur, and they most often occur in or above the neck. So you'll have chronic infection of the sinuses, a root canal. Root canals are always chronically infected. Usually, it's subclinical, meaning it's the symptomatology is so minuscule that it is not clinically evident. You also will find chronic infections in the mandibular process. That's the area just behind the earlobe on the bottom of the skull. And if you put your finger there and push on it, if it's sore, you probably have a chronic infection there. The palatine tonsil, that's the tonsil in your throat that you get cut out sometimes when you're a kid. Those
Yeah.
sometimes get infected and stay infected. So, again, these are areas that you would look at. And remember, this presentation was originally given to a group of doctors. And so I would say to them, if your patient presents this way, consider these problems. And I say to the Limbicarc audience, if you're having a problem, you may want to then talk to a practitioner who can address these issues for you, because Limbicarc is not going to treat a medical condition. It's not going to cure a medical condition.
That's so important to say, Dr. Cook. I know that it's great to see the back behind this, and that there's a lot of things that are happening and things that we can work on. But it's nice to know that this is something that is intended for wellness. If you're sick, go see a doctor. If you truly have an issue, go see somebody who's licensed to take care of it. But if you just want to work on your wellness, limbic arc, I mean, there's a lot of good reasons that this helps, and it's interesting to see behind that. So thank you for that.
Okay, let's move to the next slide. So here are some um, info boosts that I would look to for help with a focal disturbance. Now, let's assume that uh, that I am the female who is having difficulty conceiving. I can use these info boosts without knowing what the problem is. In other words, you can cure an issue without even identifying it, and there's nothing wrong with that. You know, if you're trying to have a baby, you might want to use these anyway for whatever reason.
Right.
Okay, then energetically, these are the points that you would use to address the conception issue. And I will tell you, George, that it works. I mean, I've had patients who've come in with this particular problem, and we've worked with them, and lo and behold, they got pregnant and had healthy babies. So it works. Okay, and here's again another picture. These are just some of those same points, and you can see them with the needles in them.
Right. I I love
And
how
I
the experience, the personal experience that you've had, as acupuncturists and tying together all of these different things together, Dr. Cook, is pretty astounding when you look at it.
well, I've had good clinical success over my career,
Yeah.
and I don't think it's because I'm particularly a good doctor or particularly smart, but it's because we approached problems from more than one angle.
Right.
Everybody who presented didn't have just one problem, and we became specialists in that one problem. We became, and I say we, meaning the people who work for me in my clinic, we would address detoxing, we would address nutrition, we would address diet, we would address, emotions. And when you address all of these things at the same time, you get great results because you don't leave any of the parts hanging, or at least you support the body to the point that it can then heal itself.
Right.
And it is fun. It's very satisfying.
Well, it all has to work.
Okay. Yeah, it does. It all has to work. Okay. The last condition is breast health or lactation issues. So, a woman who's nursing her baby doesn't have enough milk, gets stressed out about it, comes into the clinic and says, "What can I do?" Well, I will tell you that when it comes to breast health, there's always an emotional issue. For
Okay.
some reason, breasts are a very emotionally related organ. And so I would recommend a CERT info boost in any case about this, and that would improve that quality of life. The next thing I would recommend is to do a breast exam on yourself. Make sure that you don't have any, thing that you need to go see a doctor about. If you have some kind of a breast cancer issue going on, that can be a
Right.
problem. Um, and and even in my clinic, I never treated cancer. I treated a lot of patients who had cancer, but I never put myself out as a somebody who knew a lot about cancer. And we had a good relationship with the hospital, and they would actually refer their cancer patients to us who wanted to do something holistic. But if somebody came in with a breast issue and I thought maybe it's cancer, I would send them to a specialist.
Right.
It's important to remember that there's a lot of lymphatic tissue that is included in the breast, and so you may do a breast exam on yourself and find a lump or something that doesn't feel right. Don't panic because it could be a clogged lymph node,
A duct or something. Yeah.
and everything that's normal about the breast isn't cancer. So you just don't have to panic if you see something abnormal. But that's why detox is an important part of this whole process of treating
Yeah.
any kind of female health. The other thing to look at is what are called dermatomes. And if you look at our model here, the dermatome, that's an area that's on the skin that's innervated by different vertebrae, nerves coming out of different vertebrae. And so if you look at her breasts, you can see that the upper thoracic vertebrae, as she turns around, and then you look at the back of her, so those upper thoracic vertebrae will innervate the breast. And so if a woman comes in and has breast pain or even a lactation issue, look to the vertebrae, because if she's got some kind of a chronic back problem in that area, it may be that that's what needs to be addressed.
Okay.
And the info boost that I would use in this case, multi-nutrition would be a good one. Again, I would use the pain and I would use other ones for specific issues. But for a woman who wants to produce more milk, multi-nutrition would be good. Stress relief is good. Stress relief is good because if you're a mother and you're trying to nurse your baby, but you don't have enough milk and your baby's always crying and you worry that, oh my gosh, is he going to be, grow up and be malnourished because I'm not doing a good job as a mother, it becomes stressful for a woman. And so if you can help her relieve that stress and again, get the emotion changed, then if she can relax, she'll naturally produce more milk. That's
Right.
part of the equation. Okay, here are some points that are specific for breast health, and you'll notice that more of those are around the breast. There is a point on the small finger. You can see it there, SI1, that small intestine one. One of the indications for that point is specifically insufficient lactation. In other words, if you want to produce more breast milk, you stimulate that point, and it would not be inappropriate for any mother who is in this situation to massage herself on that particular point, and just massaging that point will have a positive effect. And we have 2 slides to go. This is the second to last one.
Okay.
These are some of I put the little superhero on this one because these are kind of the some superhero points. And the next slide, which is the last slide, these are the superhero points. So you can see we've got liver 3, spleen 6, liver 9. Liver 9 is the one you can see where the needle is on the inside of the thigh, and
Fine,
large
right.
intestine 4. And those 4 points will work miracles. I mean, putting needles in those points on women that have any kind of a problem, sometimes it's just, you go, holy smokes, this is amazing what these do. So,
Right.
and I put this slide towards because if a woman remembers these 4 points, you can self-administer the therapy like I mentioned before. You could take a eraser on a pencil and you just massage those points gently, and
Yeah.
the acupressure will have a positive impact. You don't necessarily have to stick needles in those to get a good effect.
Wow.
So that is our presentation for today, and I
Wow.
hope the takeaway is um, that Limbicarc, to the extent that a female health issue impacts your quality of life, Limbicarc
Yeah.
can be a positive aid to improving that quality of life.
Well, and Dr. Cook, one of the things that's my big takeaway, I love how you're taking different info boosts that are there and you're pairing them together in ways to really help to get things happening. And so that was my important takeaway from that. Starting with detox, then working with other things. It's I like how you're using them in combination. So. Boy, I just let you go, Dr. Cook. I know that we went a little bit longer than we were supposed to. There was no way I was going to stop in the middle of that information. That was so powerful. And so we're just going to go ahead and wrap things up. Just put on your calendar for next our next call is going to be Wednesday, April 27th. That's going to be 10 o'clock Mountain Time. And to everybody there, if there are such great topics that we've addressed, be sure to go to our YouTube page. Be sure to go to the calls with Dr. Cook. They're on every page of our website, and look at those and look at some of the past topics. And a lot of times people will have questions that they'll ask. Many times those are already gone through, and you'll find videos on those very specific topics. So take time to familiarize yourself with some of the past topics and listen to some of that, because it's really, really powerful. And as always, you can send in a question with Ask Dr. Cook at limbicarc.com. So anyway, thanks everybody for coming. Dr. Cook, thank you for such an insightful and powerful presentation today. We appreciate that, and we look forward to our next call. So from all of us here at Limbicarc, have a fantastic month. We look forward to seeing you next month.
Thanks, everyone. Bye.